here for your checkup? Okay. What was your name? Okay. You're just in here for regular checkup. Okay. Right, we need I have some x-rays to show you from last visit. Okay. Do you have any other concerns or anything you want me to look at? Okay. Well, that's good. That you're doing better. Okay. Hopefully the medications were helping. But yeah, we'll take a look at the x-rays and see what else needs to be done. I'm just down a couple things. Okay, I see you have an allergy to... Okay. Make sure you take note of that. Can you tell me your birthday one more time? The year. Okay. And I'm just taking down a couple of notes for my nurse assistant later. I feel like we can get started on making sure everything's the way it's supposed to be. Okay. Yes, I have this kit that I bring with me when I see every patient. And I have your x-rays already in here. Yeah, my nurse assistants keep me organized. Alright, let's go ahead and check your heart rate and breathing. Okay. Yeah, if you can just breathe in and then breathe out. Breathe in, 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 breathe out. Check. Here. Breathe in, breathe out. 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 You know the drill. Sounding good so far. Okay. Alrighty. Next, we'll go ahead and check your blood pressure. Is there anything you're stressed out about lately? I'm sorry. Well, I can take care of that in a minute. But first, let's just see what your blood pressure is saying. So, I'll just take, yeah, that arm. Okay. Okay. Just relax. some high blood pressure. Yeah, but that's okay. I can take care of that for you. We have some new techniques. Actually, I need to write this down. It's like over that. Okay, I'm just gonna go ahead and take this off. And we will check again after, at the end of the visit. Okay. Let's check your temperature. Okay. Just hold still. Looks good. And yeah, just write that down. Okay. I'm gonna have to check your reflexes. Okay. Just relax for me. I'm just gonna test. Okay. Okay. Good. Looking good. Before I do the ears, let's go ahead and go over the x-rays. So, a couple different. So this is the x-ray of your rib cage. As you can see, here's your collarbone and your arms, and it looks like you do have each of your ribs intact and facing the right way, and your collarbone is looking healthy. Yes, you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Looks like you have all of your ribs there, and you have your heart. So everything's looking normal there. But the x-ray, so I know you were talking about the foot pain that you're having. Well, it looks like it might, the target area are your toes right here. They're a little bit too spacey. It looks like you're missing some cartilage in the joint connecting to your toe, which is a problem and can cause pain. So I'm gonna have to use, yeah, you don't need to worry though. There's an easy solution. I can inject some cartilage hormone shots for you, and I actually have it with me right here, so it's easy peasy. You won't feel anything but a pinch. Alright, so just gonna get this. Yeah, don't worry. When I count to 3, you'll just feel a tiny pinch. That's literally it. Okay, ready? 1, 2. have to be injected at least 4 areas so that the bloodstream will really make sure it gets the targeted area. One more round, I know. But see, it's literally not even a pinch. I told you. Okay. You have a scrape on your elbow? Aw, let me look at that. Okay, let me get my band-aids out. Here. Let me get, it looks like you have some like gravel still in your elbow. My goodness, what'd you do? You were rushing on your bike to get to class. Oh my goodness. Let's try to be safe, okay? I'd rather you be late to class than injure yourself. Okay. Just wipe this off. These are some sterile gauze cleaners. Speaking of sterile, excuse me for totally forgetting my due diligence. It's when you know you've been working this job too long, you just forget the simplest things. You feel that at your job. Especially if you're working and going to class, that's a lot. Well, I hope it gets better and you're able to get the needed rest. Okay. There we go. Alright. Oh, you're looking to do something in the creative. Oh, that sounds like fun. I hope that works out for you. Yeah, it's a big difference, like when you're able to do something you really enjoy and you're passionate about. That's so exciting. Well, good. I'm sure that would help your blood pressure too if you were able to make that transition. So I'm just gonna put this. I didn't even ask which band-aid. So we have a couple different options of band-aids. Do you want the pink with the polka dots and the pink heart, or the white with the different color polka dots? This is an important question. Okay. I also love the multicolored polka dots, so I was just automatically going with that one. Okay, I'm just gonna, you can just hold your elbow back up. There we go. Okay. That's good. That'll protect it and keep it from getting infected. Of course. Okay. Now let me get a look in those ears. So if you can just turn a little bit. There we go. Just gonna see. Excuse me. Just had some, actually it was a sandwich not too long ago, so, okay. It's looking normal, but we might just do routine cleaning. Just get this ear. Yeah, that one's also looking normal. Okay. But we do need to clean them a little bit, so let me get let me first just give it a wipe down. Here, get this here. That ear. Okay. Just gonna get one of these. Cotton swabs. I'm just gonna go ahead and get this ear over here. Okay, if you can just turn a little more that way. Okay. Okay, and then we'll just, you can turn this way. We'll just get this ear. And clean it out a little bit. Okay. Yeah, those get thrown away. Okay. You can already tell the difference in hearing. Yay. Okay. Oh, and the pain in your foot is already gone. Yep, that's the injections. Okay. Now, I told you we had new techniques for getting the blood pressure to a normal level and reducing stress. Well, this is the technique. So I'm just gonna grab all of your stress and I'm just gonna cut it off you, okay? And don't worry, it's not painful. It's actually relieving. So I'm just gonna take all this and I'm just gonna yeet it out of existence. Now these smaller pieces are sneaky, but they're still very important to make sure we cut them off. looking a lot better. I don't see nearly as much anxiety or tension, so yeah, just some of that is like needs to just come out straight from the chest. Yep, so you can breathe better. That looks a lot better. Let's go ahead and check your blood pressure and see if it's normalized. Okay. Okay. That's good. Okay. It's leveling out and it looks, yeah, back to normal, so that's a win. A win is a win. Okay. Let me use my other pen. Blood pressure. Then I'll use black to kind of circling what I want my nurse assistant to enter into our system. Okay. Yeah. You feel so much better? Good, I'm so glad. That's what I'm here for. I mean, of course, we can up the schedule for checkups to more than annual if you need that. Yeah. You think, yeah. I mean, there's not a smiley face on these scissors for no reason. They really make you more happy because they take away all the stress and all that junk that you don't need weighing you down. Okay, well, you can go ahead. I'm gonna save, make sure I save these x-rays. And the next checkup, I'll take another x-ray of your foot to make sure that the injections have like fully taken effect. And yeah, so just a note for my nurse assistant. Okay. Alrighty, well that's it. Yep. I'll go ahead and be on my way, but just give me a call. You still have my number? Okay, good. Whenever you need me, I'm there as your home doctor. Yeah. I know, I mean, it's awesome that we were able to adopt some new techniques to help because the medications for the blood pressure, oof, they just weren't helping. So yeah, we found the solution. Alrighty, well, I'll have to catch you later, okay? Bye.